So and then the one is just going to be, you know, one of the classifications of them. So there's H5N1, H1N2. These. So whenever you see them, now you know that that's just a classification system. Mostly the same as common influenza in terms of symptoms. You get fever, cough, sore throat, chills, body aches, fatigue, headaches. But nausea, vomiting, and diarrhea, you know, aren't as, you know, that's something that's a little bit different a lot of times than common influenza, but these have also shown up. In order to confirm that it's H1N1, you need to do a culture, okay? And this is where we have some of the big problems, is that things have been called H1N1 that weren't H1N1 when they actually look at the data. So call your doctor, and this is really with anything in terms of any flu you get, or if you have trouble breathing. These are kind of no-brainers. If you look, if you look blue, you should probably call your doctor. You know, if you can't drink anything, or that's not as bad. But you know, if you end up feeling like you're really dehydrated and you don't want to drink, you need to get fluids. You know, if you have no tears, scanty urine, meaning you're not urinating very much, that can be an indication of dehydration. Constant sleep, difficulty keeping awake, these can be also some signs. If you have one of these and it doesn't, you know, just use your common sense, really. Extreme irritability, that's also one of the signs of inflammation and so forth. Or if the symptoms subside and they come back with a vengeance, okay? So then you probably want to go see somebody if that kind of thing happens. Most of these you don't necessarily, you know, have to, but definitely if you look gray or bluish, you're having problems with breathing, these kind of things. Okay, so the vaccine. So there are two types of H1N1 vaccines. The first is a nasal spray. So this is contraindicated for pregnant women or children, as it can easily cause intense flu symptoms. It is a live virus. It's not recommended for pregnant, we already said that, and breastfeeding mothers. And according to some sources, for 21 days after flu mist, the virus can be shed through body fluids, feces, and so forth. So contact should be avoided with those who have weak immunity. Well, if you're using a live virus, of course, the virus, even though they say that it's temperature dependent, and viruses mutate, that's just their nature. So it could definitely make it so that it could adapt to your temperature. You could actually get the flu from it. How many people here have known people who get the flu shot and they get the flu right afterwards? Yeah, pretty much everybody. So these are some of the things with the live viruses that can happen. Other things,
definite replication of them, you know that.
Yeah. And then other things are, if you're suppressing your immune system, again, going after one, then you're more susceptible to another one. So it's not always you're getting it directly from the vaccine, per se. So it's unclear whether pregnant women can contract the virus from those who are vaccinated with the nasal spray, but if I were pregnant right now, I wouldn't be around anybody who used the nasal spray for a vaccine. Recently, that is, within the 21 days.
But you don't know because they don't like wear a sign or anything.
No.
Well, I'm not saying anyone. I mean, you're not going to get H1N1 just from, you know, walking by somebody, or, you know, I mean, if you're real close and they're coughing on you or breathing on you or something, or they're, you know, you're not taking care to wash your hands, or you're letting them touch your face, you know, then possibly. Okay, so the inactivated virus injection. Okay, so those are contraindicated. So inactivated means it's not alive, basically. Those with severe egg allergies, because there are egg proteins inside of the vaccine. That's how they grow the virus. And children under 6 months, doesn't seem to be effective. Not very many contraindications for that, I guess. Nasal spray contraindications are, again, severe egg allergies, children under 2 years, and adults over 50 years. By the way, adults over 50 years are mostly immune anyways to H1N1 because they were exposed to the virus around the 40s, 50s at that time. So they really don't have a problem anyways, even though it seems to be that the elderly are the ones that are trying to push the vaccine on. Pregnant women is another one. Weakened immunity, long-term health problems, those on long-term aspirin treatment. I guess they worry about Raynaud's syndrome or something. Children under 5 years old with asthma or wheezing, any muscle or nerve disorders, anyone in close contact with a person with a weakened immune system. Okay, so both vaccines. Tell your doctor if life-threatening allergic reaction to a previous flu shot. Okay, I think most of you would do that. Guillain-Barré syndrome, that is type of neurological disorder where you start basically paralysis. You can become a quadriplegic from that. Most people will recover from Guillain-Barré, not necessarily fully, but about 1 in 20 people will die from Guillain-Barré. 1 in 20 who have it, not 1 in 20 who have flu shotters. Okay, so H1N1 and the regular flu shot. There was some interesting Canadian research that has not yet been published, so we can't analyze it, but it was officially presented. And it demonstrated that prior inoculation for the seasonal flu may increase the chances of contracting the H1N1. And the CDC's looked at this in the US population and says that there is no correlation in the US population.
They said they looked at also studies in Mexico and Australia as well, supposedly.
Said that court. But, as far as I'm concerned, when I look at things like this, I say, you know what, there's a mechanism for it.
Yeah.
It weakens your immune system every time you get a vaccine, even though they say it strengthens your immune system. It strengthens it towards one particular thing, but weakens it in terms of its ability to respond to other things. So reason one may want to get the H1N1 vaccine. Okay, so first, it may actually protect you from the H1N1. And it's very likely because we know what strain it is. So this is actually, if you're going to get a vaccination for something from the idea of a vaccination, this is one you would want to get. A regular flu vaccine is just, again, rolling the dice. I don't know if it's the right strain or not. It may do nothing for me other than expose me to mercury and things like that. But this particular one, even though you still get exposed to mercury in most of the vaccines, there are some you can request it without mercury. That I think it was 10% of them have been made without. But it will likely protect you from the H1N1. Although obviously we haven't had a lot of time to study it because it's a fairly new occurrence. So it may protect others from H1N1. This is the idea of herd immunity because, immunizations, no one in the vaccine community claims that vaccines are 100% effective, right? So the more people who get vaccinated, the less likely it is for this virus to really become a major epidemic, right? And so it's not so much, in my mind, it's more of a concern that this virus could turn into something really bad. But why this particular virus could turn into something really bad and other flu viruses wouldn't turn into something really bad is still a little bit unclear given the history of this virus. So that's not something I'm really going to go into here, but anyway, so reasons one may not want to get the H1 vaccine. It seems to be a mild flu for most people. It's actually, in the reports, the flu symptoms have been less than what they have been for other strains. So if you're going to pick a flu to get, H1N1 would be the one to get for most people because it's more comfortable from that standpoint. The vaccine is untested and may have shorter long-term adverse effects. We don't know. Just because they make something similar to the way they make other things doesn't mean that there's not some unique reaction of that particular viral strain or of some combination of what's going in there. And so it really is untested and we don't know what's going to happen. Maybe end up being perfectly safe. It may end up causing some long-term consequences like it did in the 1970s where you had pretty much an excess amount of Guillain-Barré that we were talking about earlier. Many H1N1 vaccines contain neurotoxic ingredients. Even the ones without mercury have other ingredients in them that may be neurotoxic. And again, some of them aren't disclosed. So we can't really analyze the safety very well. And we have to ask ourselves, why aren't they being disclosed? I'm not. And again, we talked about the confusing positions from the CDC regarding mercury. It's dangerous, but it's also perfectly safe, right? Okay. Reasons one may, okay, this is continuation. It can be treated by current antivirals. The strain is susceptible to Tamiflu. And as we'll see in a little bit, it's been studied in a number of natural substances as well that it seems to be susceptible to a treatment with those also. Preliminary data suggests that most deaths are not from a virus, rather from bacterial complications. So you get the virus, it weakens your lungs, and then maybe you had something else, or maybe you were in a hospital and you contracted some other bacterial infection that then knocks you out, which is very common. Hospital-acquired infections are unfortunately very common. And that's a whole other lecture.